my name is Dr. Praveen Khilnani, and I'll be explaining about the various instruments that are used for central line. First of all, this is a 6-year-old patient who requires a central line, and what we will be placing is called a double lumen central line. It has got 2 lumens. It is a 4 French catheter. It is 8 centimeters long, and it is made up of silastic synthetic material. And then there is a needle and a syringe that we use for all central lines. The needle is of the size through which the guide wire will easily pass, and guide wire is this that is provided along with the central line set. This technique of central line placement is called Seldinger technique. In Seldinger technique, once the needle pricks the central vein, guide wire is passed, and then the vein is dilated with this dilator. So that is why a dilator is also required. And then over the guide wire, this catheter is placed. For preparation of the site, we require betadine, we require a sponge holder, and for suturing of the line after the line is placed, you require sutures and the suture holder. For us to be able to place the central line properly, a heparinized saline must be drawn in a sterile fashion. So that the needle, when it is used for central line placement, is free of any clots when the blood draw is done as soon as the central line is placed. Dr. Uttam is now going to show the actual procedure of central line placement. Must be followed. So as you see, Dr. Uttam is now wearing sterile gowns, gloves and caps, and the first step is to clean the site with betadine. During the cleaning, it is important that one cleans the center of the site first and then goes peripherally. Betadine should be allowed to dry to make sure that the skin is adequately sterilized. And the next step is draping. Sterile cloth with a hole in the center is placed at the site. The site in this case that we are using is the left groin for left femoral vein central line placement. Other sites that are available for central line placement in pediatrics are internal jugular and subclavian, but we try for the femoral venous approach first. If that is unsuccessful, then other sites may be used. First, in this case, we are trying in the left groin, left femoral vein. This includes the sterilization procedure. Site is all prepared now. First step in pricking the vein is to feel the femoral arterial pulse. The vein is approximately located medial to the femoral artery in the inguinal area. That is now going to be attempted to be punctured. Now, as soon as the blood draw is seen, the blood comes back, the needle is detached from the syringe. The next step is placement of guide wire. For the placement of guide wire, the J end of the guide wire is to be placed so that when it enters the vein, it turns into a J, so it does not puncture the vein. It is required that such a guide wire placement should be smooth and no force should be used to place the guide wire. In this case, as you see, the guide wire is going extremely smooth. The next step is to leave the guide wire where it is and take the needle out so that a dilator can be introduced. During this time, the assistant holds the gauze at the guide wire. Since the puncture of the needle is very small, it is also important to use a needle at the entry of the guide wire to just increase the size of the wound so that a dilator can be properly introduced. The doctor who is performing procedure is right now trying to dilate the entry at the guide wire site. This facilitates a smoother placement of dilator. The dilator is being now introduced over the guide wire. And the dilator is now being introduced into the vein so that the entry in the femoral vein is properly dilated. Since the wound at the groin is dilated, there is a problem of blood gushing out, so one must make sure that the assistant keeps the gauze piece at the wound entry site to prevent any excessive bleeding. Now, the classic Seldinger technique is being followed, in which the central line is being passed over the guide wire into the wound and the guide wire is then pulled. A placement check is confirmed by withdrawing blood at the central line site at both lumens. And it is required that free blood flow should come from both lumens. The operator is right now getting blood from the distal lumen. Both lumens need to be flushed. Doesn't matter. After the central line is placed, it needs to be secured with sutures and then dressed with sterile dressing. The suture size should be preferably 2-0 or 3-0 silk with a curved needle so that both flanges of the catheter are properly secured at the skin.
Take it away.
After the suture placement, The central line site should be properly dressed, the ports adequately flushed, and both the ports of the double lumen catheter should be treated with sterile aseptic precautions to prevent any introduction of infection. After the central line placement, we obtain a chest x-ray, a groin x-ray to check the central line placement. Let's go. This is the procedure of sterile dressing of the central line. That concludes the femoral central line placement procedure in a pediatric intensive care patient.